Welcome and good evening to you all. I'm Preeta Harikrishnan, Deputy Manager, Department of Admissions, Amrita Health Sciences, Kochi campus. Thank you for showing interest in this webinar on career as physician associate. Our guest for today is Ebin Abraham, sir, Assistant Professor and Coordinator, Amrita Center for Allied Health Sciences, Kochi. Apart from teaching, Sir also helps in the smooth conduct of the academic and administrative functions of the center. He has 1.5 decades of experience in various clinical settings in major hospitals across the country. Ebin sir has completed his master's degree in physician assistant studies from Amrita University, Kochi, with a specialization in cardiac surgery. He has a long clinical career at Amrita Institute of Medical Sciences, Kochi. He also has a post-graduation in public health and hospital management from the Public Health Foundation of India and a master's in business administration. In addition to his academic works, he is very active in the Indian PA movements and its further development, serves as a general secretary of the Society of Physician Assistants. He's also a member of the Association of PAs in Cardiothoracic and Vascular Surgery, and the International Academy of the Physician Associates Educators. He has many publications to his credit and has been an invited speaker to several national and international conferences. I welcome you, sir, this evening to address our viewers.
Thank you, madam. So good evening, one and all present here. I am Ebin Abraham, and I'm an assistant professor and coordinator of Amrita School of Allied Health Science. Today, as a part of this webinar series, I'll be talking about this program, a physician associate, and a profession which I am a part of for the last 2 decades. So today we'll be covering these topics like who is a physician assistant or associate. You may be getting confused this word assistant or associate, since the profession started with the name assistant, and recently the name changed internationally and the government of India to associate. So the newer name of the profession is associate, and the older name is assistant. So whenever I am using assistant or associate, it is the same. So next we'll be covering what does a PA do. PA is a short form of physician assistant or associate. The physician assistant education, exploring the opportunities, scope of the program, and finally, why you should choose Amrita to study the PA program. So I'm sure you will be in this stage of confusion for selecting a program or profession after your +2. There were no confusion for you till your 10th or +2. But after that, you will be in very much confused to where to choose, where to go, how to choose to pursue your future career. So there are n number of options, at least 200 options for you to pursue a career after your +2. And the list continues. I have almost 200 different kinds of programs of courses in my list. And since you are attending this webinar, I assume that majority of you are NEET aspirants, and majority of you want to consider a career in healthcare. And if you are a NEET aspirant, and if you want to do something in healthcare, or if you want to become a doctor, but you are not getting the adequate NEET score, then you please continue listening. So if it is medicine is your career choice, the majority of you and your parents must be knowing only these names: MBBS, BDS, BAMS, BHMS, and few of you must be knowing BSc Nursing, BPT, and BPharm. These are the popular courses, or the people who usually refer as medicine. But is this the only option to pursue a career in medicine? I will say no. There are a number of options. And I will introduce a newer concept, newer maybe 50-year-old concept, which was developed from the US in 1960s, when there were severe shortage of doctors in the American healthcare system. They developed a newer profession or newer concept called mid-level health provider, who works like a doctor, who will work in between the nurses and other healthcare providers and the doctor. So the newer concept is called physician associate, and it was developed in the US in 1960s, and it is further developed in the coming years. And this concept was spread across the world, including India, and the profession gained a growth in the last two to three decades. And it is one of the fastest growing profession in the world. It is the best career opportunity for a person who is pursuing their career in medicine in the US, in UK, and even in Germany. So that is the most demanding and hottest job in these countries. And even in India, the number of PS schools increased from some 20 to 25 to 150 in the last few years. So who is a physician assistant or associate? So physician assistant is a medical professional who works with the doctors to provide all the areas of a doctor who provides like diagnostic, therapeutic, preventive healthcare services to the patients of all ages. So PS practice in many medical and surgical specialties. They used to take patient histories, perform physical examination, order studies, prescribing medicines, and developing treatment plans. So almost all the works of a doctor PA does. So the job profile of a PA is a PA can work in all medical and surgical specialties which are available in that particular country. So she can conduct patient interviews. They can take medical histories. They can conduct physical examinations. They can order and interpret diagnostic tests and examinations. They can diagnose illnesses. They can formulate treatment plans. They coordinate and manage care. They perform medical procedures. They help in prescribing medications. They conduct clinical research. They provide patient counseling. They offer advice on preventive healthcare. They assist as a first assistant in the surgery, etc., etc., etc. So coming to the education of a physician associate, the entry level education in India is a Bachelor of Degree, and it is a 4-year degree, 3 years or 6 semesters with a 1-year internship. So the next level is post-graduation, that is Master of Physician Associate, and it is 2-year, and the PG program is in different specialties. And we have doctoral programs, PhDs. PhD is 3 years for the full-time takers and 5 years for the part-time students. So coming to the PA training. So the training of a physician assistant is almost equal to a medical doctor, and the training is conducted in medical college. So we have a 8-semester program and 6-semester theory and practical classes and 2 semester of internship. The first year of PA training, or the first 2 semesters, we are focusing on anatomy, physiology, biochemistry and molecular biology, microbiology, introduction to healthcare delivery system in the country, professionalism, communication, soft skills, introduction to computers and community orientation and clinical skills. These are the areas which are we are focusing on the first and second semester. So the third and fourth semester, or the second year, we are focusing on pharmacology and toxicology, which deals with the medication and medicine practice, pathology, then medicine and surgery, ENT and ophthalmology, gynecology, psychiatry, dermatology, pulmonology, orthopedics, medical communication, then community medicine, clinical research, and you will be having clinical posting in the second and third semester in these areas or specialties. And in the third year or fifth and sixth semester, we will be focusing on pediatrics, emergency medicine, nephrology, gastroenterology, endocrinology, medical ethics and law, introduction to healthcare management, cardiac science, neuroscience, neurosurgery, GI surgery, urology, community medicine, clinical research. You will be having a research project to undergo in the third and fourth semester, and clinical posting in these super specialty areas. And in the final year, or the seventh and eighth semester, the PA students can choose a particular specialty or super specialty, and they can get trained in this particular area. So coming to the career pathways, a physician assistant can choose two pathways. Broadly speaking, we can choose clinical pathway or non-clinical pathways. So in clinical pathway, there are n number of choices a PA can practice. The PA can practice in cardiology, neurology, urology, cardiac surgery, nephrology, endocrinology, gastroenterology, general medicine, surgery, oncology, critical care, rheumatology, surgical oncology, medical oncology, orthopedics, GI surgery, general surgery, pediatrics, pulmonary medicine, liver diseases, breast clinic, breast surgery, radiation oncology, transplantation, plastic surgery, neurosurgery, electrophysiology, family medicine, stroke medicine, robotics, spine surgery, pediatric surgery, orthopedics, etc. There are n number of at least 40 to 50 specialties the PAs are practicing in the state. So the PA can choose the non-clinical areas, like the PAs can move into administrative healthcare administration. They can move into pharmaceutical companies as application specialists. They can move into biotechnology. They can move into medical device companies as advisor or application specialists. They can move into medical writing, EMR specialists, academics, medical informatics, research, etc. These are the broad areas where a PA can practice in both clinical and non-clinical areas. So who should consider studying and to become a physician assistant? So those who are want to pursue their career in medicine, and those who their dreams to become a doctor, and if your ranks are not up to the marks to reach MBBS, you can definitely choose physician assistant. People-oriented individuals, those who want to heal, those who want to care people, those you can choose physician assistant. The PA should be a team player, because the PA work as a team player in a healthcare team. So the person who should be flexible seekers or lifelong learners, and the person who are compassionate, those who are seeing others' pain as your pain, those people can choose the PA profession as your career. So what is the benefit of pursuing a career in physician associate? So it is a accelerator way or accelerator entry to the healthcare field. A doctor or a specialist, or for example, a person who want to practice cardiology or cardiac surgery will take 17 to 18 years to reach there, because they have to do MBBS, then MS or MD, then post-graduation. So they will take minimum of 15 to 16 years to reach there, but a PA can reach within 2 to 3 years. You can reach the desired areas. Next is the shorter training duration when compared to other medical professionals or doctors. They have diverse career opportunities because almost all the allied health programs or any other profession, if you are taking, they have to, or they can work only in one particular area. They can only work in one specialty. But a PA who are trained in medical model or who are trained in a medical college can work into n number of specialties. So there are opportunities, career opportunities, or diverse career opportunities for the PAs, and they have the opportunity for the patient interaction and responsibility, unless like other some areas or courses, they are basically looking after some machines or some technologies. But those who are interested in patient interaction or people interaction or taking their responsibilities, PA is a right choice. Team-based approach, those who are very good in team-based practice, who can become a good or choose a good career in physician associate profession. There are n number of opportunities in career, continuous learning and growth, job security and demand. So the competitive salary and benefit when compared to other professions, the salary scale of PS are little high, and you can fulfill a rewarding career in the medicine. These are the benefits of pursuing a career in physician associate. And the bigger question, why to choose Amrita as your training center for the physician associate program? Amrita University is a multi-campus university, and it is among the top universities in the country. It is ranked as the 7th best university in the country, and our medical college is ranked as the 6th best medical college in the country. And Amrita is being ranked as the best universities across all the international university rankings for the last 10 years. So Amrita is one of the leading university, not only in the country, but it is one of the best university in the world. And coming to the PA program at Amrita University. Amrita University's PA program is one of the oldest PA program in the country. It is the second PA program in the country. It started in almost 25 years back. So the experience of conducting a PA program in Amrita is too much. So we have very much experienced senior faculties, both the medical, like doctors and senior physician associate in Amrita PA program, and that you will not see anywhere in the country. So these are some of our faculties. Our senior doctors taking classes for PS. As you can see, all these are the senior professors in the country. And unless not like other programs in the country, we are focusing on hands-on training. The PA students are getting training in the second semester onwards. They are getting trained in the clinical areas, and it is the only one program which is conducting in a medical college, and the only one program which is attached to a quaternary care multi-specialty hospital called Amrita Hospital. So the PA students are getting ample training. Before touching the patient, they are trained in simulation model training, and they will be directly introduced to the patient care areas. And we are attached to the Amrita School of Medicine, and the training is conducted in Amrita School of Medicine, and the PA training is almost equal to a doctor's training. And these are some facilities we have in our simulation lab. So almost all the training of PAs are done here before they are going to the patient care areas. And this is only one program in the country which is providing almost 25 specialty training during their entire course duration. And the classes, the first year classes are in medical college, and second year and third year and in internship period, they have classes in medical college, they have classes in OP, ward, ICUs, they have classes in all these patient care areas with the senior doctors and senior physician associates. So coming to the physical infrastructure for the students to learn from Amruta Institute of Medical Science, we have almost all the most modern equipments in the country, which is available. We have the most modern machines. We have the most modern technologies. So it is one of the leading hospital who's introduced 3D printing technology, and we are using this technology to for teaching, learning, and for patient care areas also. And it is one of the leading robotic training center in the country, and we are doing more than 2,000 to 3,000 robotic surgeries in different specialties around the years. And we have the robotic animal training center in the country. It is, I think it is only one center in the Southeast Asia who is providing robotic training for the doctors. So the training of PAs are not only bounded or to the classrooms. The PA students are integrated into different communities, and they are introduced to community postings, and they are regularly visit the nearby communities and learn their healthcare problems and find solutions. And these training are done by our community outreach centers, which are located in Kochi, Kaloor, Nyarakkal, Amruta Charitable Hospital in Kollam, Kalpetta, Trivandrum, Mumbai, Mysore, and in Wayanad. So the physician assistant students are getting a number of ample opportunities to get trained in these community hospitals. So PA students and faculties are leading or taking the role in educating the general public. So we are taking regular classes for the school students, for the other general public, for different areas. And now we are focusing on breast cancer and human papilloma virus injection. So we are taking regular classes for the school students and college students. The PA students and faculties are taking a lead role in taking these classes. And the PA students are getting a lot of opportunities in medical camps. So they will learn the importance of the social determinants of health and other areas of health. And PA students are helping in medical camps in different areas of the country. And the PA students are trained in other areas also. This is our monthly releasing magazine called Passion. So the PA students are trained in other areas too. So PA program in Amruta is an international program, and we have collaborations with the leading universities in the world. And these three universities, we have collaborations. We have a collaboration with the Stanford University PA program, University of Birmingham PA program, and the University of Utah PA program. So they help us in developing the curriculum in an international manner. So the University of Utah's, we are adopted the University of Utah's PA curriculum from 2017 onwards. In last year, we had collaboration with the Stanford University and University of Birmingham, and we are integrating the curriculum aspects from these universities. And the students who are studying a PA program in Ahmedabad University can pursue higher studies in these universities, and we are looking into another 10 universities for collaborations across Asia, Australia, and Europe. So the students have multiple opportunities to interact with the students from these universities. They have collaborative classes. They have collaborative learnings like problem-based learning. We have a faculty-student exchange. So students from this university come visit our university and learn, and our students have the opportunity to go these universities also. So our students are regularly participating, our students and faculties are participating in conferences, workshops, seminars across the country, and they are learning or updating their knowledge. And our students won last year, they won 10 to 15 awards for best paper presentation, best poster presentation, best quiz competition. So many awards they are earning from different conferences and meetings across the country. And we have national, international webinars, collaborations. We have collaborations from a lot of organizations and universities across the globe. And we have one of the strongest alumni network in the country and abroad. Our alumni, PA alumni are there in almost all continents, and they regularly visit to our campuses, and they guide our students in the future perspectives. So finally, welcome to the PA profession. If you are a compassionate person, a good communicator, a sensitive person, a hard worker, a critical thinker, who are flexible and who is willing to work with the team, then you are most welcome. And I conclude and I thank the Division of Admissions, and I thank all the participants, and the session is open for questions, or if you have any queries, any questions, please. Thank you.
Thank you, sir, for giving us such a beautiful presentation with such a lot of slides, which really gave us as well as attendees who have joined all through the webinar now. They have surely got to know why they should choose Amrita with such advanced knowledge, such good it's like almost a good package for them. Once you study in Amrita, go for a PA, join PA in Amrita, then their life seems to be settled. So they get opportunities not working only here, but even abroad. And I think, sir, there are two questions raised.
Okay.
One is, can a person be a plastic surgeon after finishing this course?
So the answer is clearly no. We cannot become a doctor after pursuing this course, but you can practice in plastic surgery. You cannot become plastic surgeon, but you can practice as a PA in plastic surgery, and you can do minor procedures. You can assist in surgeries, and you can manage patients in plastic surgery to a certain extent. To become a plastic surgeon, you have to do the traditional way. You have to go to MBBS, then MS, then MCH in plastic surgery.
Okay, there is another question. Which specialty PA gets highest salary? Because you have mentioned a lot of specialties in which they can go to. So maybe that is the reason.
It varying time to time. It's almost depends on the person with a lot of skills. A person with a lot of skill will earn higher salary in any specialty. But maybe in neurosurgery, cardiac surgery, plastic surgery, emergency medicine, PAs are higher. But any specialty where you have skills, you will get higher salaries.
Yes, because they get a lot of practical exposure here in Amrita.
Yes.
Even I think whoever asks for, they prefer students from Amrita. So I think those are the questions which is radiology a good and stable profession? Now this is we are talking of physician associate course. So we will be having webinars on radiology, and so please join in then, and then we could give you a much more better explanation for that. So for now, I think sir has done his very best, and you have really acquired almost whatever you wanted to from this webinar on PA. But before we wind up, we have Shanley, who will be explaining to us about the admission process this year. Shanley, you could.
Thank you, ma'am. I'm Shanley. I'm here to explain the admission procedure of 2024. So in Amrita, we have various BSc Allied Health Science courses. We have 17 specialties in BSc courses. Here we are explaining the Bachelor of Physician Associate. Here is the fee structure. We have 3 categories. It is scholarship category, non-scholarship and NRI category. The tuition fees in scholarship, it is rupees 1,50,000, and in non-scholarship, it is 2 lakh, and in NRI category, it is USD 3,000 per year. Apart from the tuition fees, there is another fees of rupees 38,450 per year, and also an hostel fees of rupees 68,000 per year. Students, those who are staying within 20 kilometer from the hostel, they can they are free from choosing hostel. The course duration is 3 years plus 1 year compulsory internship. The eligibility is minimum 17 years of age and maximum 23 years of age on or before 31st December 2024. And also the student should acquire minimum 60% aggregate marks in physics, chemistry, biology, and English. The selection to the BPA course is through Amrita Entrance Examination, Life Science, Agriculture and Medical Sciences, which is known as AEEL, which is a computer-based centers which will happen in the allotted centers nearby your place. The subjects will be covered in AEL is physics, chemistry, biology, and English. And for certain courses like BSc Biotechnology, Microbiology, Pharmacy, the students without biology in their +2 can get admission in Amrita through the HSC mode, in which their marks in +2 will be considered, and also the interview marks will be considered. So basically, students, those who are having biology in +2 should write the AEL entrance, and without biology can secure admission through HSC. So next we are coming to the entrance examination details. We have now finalized the dates for the entrance examination. It will happen on May 18th or May 19th of 2024. The student can choose either May 18th or May 19th. And also there will be examination timing. We have 3 slots. Slot 1 will be from 9 a.m. to 11 a.m. Slot 2 will be from 12 p.m. to 2 p.m. Slot 3 will be from 3 p.m. to 5 p.m. So a student who is opting May 18th, there will be 3 choices for them, either slot 1, slot 2 or slot 3. And also on 19th, there will be 3 slots. So regarding the slot booking and all, you'll be getting an SMS and also a confirmation mail from the Amrita team. So that time you can log into the portal applyug.amrita.edu. There you will be having option to book your slot. So You have to book your slot at the earliest. And coming to the question paper pattern, the total number of questions will be 80, 25 in physics, 25 in chemistry, 25 in biology, and 5 from English. The total duration will be of 2 hours and total marks will be out of 240. Marking scheme will be 3 marks will be awarded for each correct answer and -1 will be deducted for each wrong answer. So the details regarding the examination is updated in the information handbook. So you can just go through the information handbook, which is updated in the Amrita website. Students who are attending the examination are requested to thoroughly go through the information handbook. At the same time, the syllabus for the examination, which is based on the +1 and +2, it is updated in the given link, that is amrita.edu/admissions/AEEL. The link is given in the chat box. Please take a note of the link. And regarding the admit card, once after booking your slot through the applyug.amrita.edu portal, an intimation will be given to the candidates by SMS or by the registered email. So that time you can just log into your portal and download your admit cards. So the candidates are required to appear at the center allotted to them as per the date and time chosen by the candidates for attending the test. You have to regularly visit the given website for the latest updates. And once after attending the AEL 2024, the results will be published after 10 days. You can access your results by logging to your application portal. So regarding the instruction for registration, already many of you have already registered. So just take care of these two websites, the common website of Amrita, which is www.amrita.edu/admissions, and also amrita.edu/admissions/AEEL. And the portal is applyug.amrita.edu. This is the only portal other than for the BTech applications. So this is the registration process. Step 1. Here you have to give your login ID, mobile number to get started and proceed according to the instruction. Fill up the personal informations as required. In the next step, you can select 3 preferences, city preferences you can submit, which is nearby your home, which is up to you. And in the next step, you can apply for the courses based on the campus. Suppose if you want to apply for the physician associate course, select Kochi campus. There you can see the physician associate courses and submit your applications. And after submitting your applications, when you click on the My Applications tab, you can just see what all courses you have selected. And if needed, you can change the application preference also. Going on to the next step is the payment. You have to remit an application fee of 550 rupees for the AEL exam, through which you can appear for BSc Nursing, Pharmacy, and also BSc Allied Health Science courses. And after completing the payment, you have to update your academic details. Suppose if you are awaiting for the +2 results, once after publishing the results, you can update the details in the portal. The portal will remain open till the time of admission. And in the document session also, you have to upload the relevant documents which you have right now with you. Later on, you can update the document session. After completing all the stages of registration, you will be receiving a confirmation mail from Amrita, including the registration number. And you have to save your registration number, email ID, and password for the future references. And if at all you have any admission related query, kindly note down these numbers of the admission office in Kochi Amrita campus, or note the ug@aims.amrita.edu mail IDs. All these contact numbers and the mail ID is given in the Amrita website BSc Allied Health Sciences pages. Please note, Amrita Vishwavidyapeetham has not appointed any agent or third-party client for securing admission in any program. Students are hereby requested to contact only the given numbers from our website for any admission related queries. Thank you.
Thank you, Shanley, for that detailed explanation.
Thank you. ma'am.
Hope the students have, all the attendees have really understood how they should do, and most of them would have registered. So we have the entrance exam on 18th and 19th. The students can choose any one of the days on which they could write the exam, and Shanley has already shown the slots. You could choose the slot. So anyway, I wish all of you best of luck for the entrance exam, and hope to meet you all soon at Amrita. We have the best faculty in all the departments, and we have webinars throughout for all the courses that we conduct over here. So please see that you attend each of the webinar and gain as much knowledge you could about Amrita. So once again, thank you, sir, for giving us your precious time and such a beautiful presentation. I also thank each one of you who have attended this webinar today. I thank all those who have made this a great success. So I think it's time for winding up. Take care. Goodbye.